Hi, Dr. Peter Bond, and welcome to the Asisa Academy. It's great to have you with us today. Thanks very much for the session that you've just run on the pathology of the renal system. We're just trying to capture a little bit of the sessions that doctors are running here. And so I wonder if you could briefly summarize for us the top 3 things that are important for underwriters to do with the pathology of the renal system.
Okay, Terence, thank you very much. Yeah, we spoke about the diseases of the renal system, the premise being though that everybody understands the anatomy and physiology of the renal system, which I think is vitally important because it slots in absolutely when it comes to understanding the disease processes. The other thing which is important is to have some sort of structured understanding of the different types or classifications of diseases that occur in the renal system, which also applies to, in fact, every other system. So what I've tried to do is group it into congenital, hereditary, inflammatory, neoplastic, which are the cancerous conditions, degenerative, infectious, which makes it easier should make it easier for the underwriter to be able to conceptualize and also understand if they ask questions about diseases of the renal system. Another important aspect is to understand the different types of tests that are required to diagnose conditions of the renal system, particularly the urine tests, which are part and parcel of every underwriting test asked for in the insurance industry. Where every client has to be examined either for a short medical report or a standard medical report. They have a urine test performed which measures blood, protein and various other things. And underwriters really need to have a knowledge of what that means. And then lastly, it's cancer of the prostate, which I know is being a little bit specific, but cancer of the prostate is a particularly common cancer and a very well researched and very well documented cancer with different outcomes for the different stages at which it is diagnosed and for the different methods of treatment. So although it is the big C, and it is cancerous, in the majority of clients who have had cancer of the prostate, life cover can be offered in one form or another. So it's very important for underwriters to be armed with complete knowledge with regard to cancer of the prostate.